You know, diabetes is very much prevalent entire world, but India now being recognized as diabetic capital of world. So, very high prevalence and incidence of diabetes, particularly type 2 diabetes. Both males and females are affected, but a very young age they are affected. So it is not the blood sugar values only. The duration of diabetes is very important. Somebody having more than 10 years of diabetes, naturally it affects the organs. Like it affects the heart, it affects the kidneys, it affects the limbs, it affects the retina, brain, blood vessels, everywhere. That's why whatever precautions you take, over a period, if it is long duration diabetes, a multi-organ dysfunction starts. Yes, but you can minimize the damage by taking the precautions and controlling the blood sugars. One of the thing is you monitor the fasting blood sugars and the glycosylated hemoglobin. Still, it is popular. There are several methods of doing that. Implantable this thing what you can keep in the subcutaneous, and they monitor the sugar 24 hours monitorings are there. Many methods are there. Suppose whatever you do, the diabetes over a period affects the organ. That is very clear. First, the heart. What happens to the heart is because of the rise in the LDL cholesterol and drop in the HDL cholesterol and rise in the triglycerides and the lipoprotein A's are high. This type of behavior is very common in the Indian diabetic population. So over a period, what are the blood vessels called epicardial blood vessels in the arteries of the coronaries supplying the heart, the major vessels, they get clogged with cholesterol of this combination, high LDL levels, low density LDL. So what they form is plaques. These plaques gradually block the lumen, and suddenly during stress time they burst and produce a clot comes over the burst, and it completely clogs the artery, produces a heart attack. This is what happens in diabetic patients. But unfortunately, the diabetic patients also neurons affected, autonomic neuropathy we call. So in this way, they don't have a typical chest pain or anything. This can happen suddenly. They get some perspiration, nausea, vomiting, uneasiness, collapse. They may die or they may go to hospital, get treated. Sometimes it happens during sleep, and sleep deaths are that's why more common in the diabetics. This is one way of presentation. Not only the major epicardial blood vessels, there are some blood vessels which are not recognized in the angiogram. These are called small microvessels. In the diabetes, the microvessels also get affected, particularly in females. We see these microvessels got affected and they produce what is called a microvascular angina. And not only the arteries get affected, they become calcified. That's a major disadvantage in diabetics. We see in Indians a typical calcific triple vessel disease. All three blood vessels coming calcific multiple blocks. The classical angiogram findings in Indian population of young individuals, very pathetic. Yes, we have many therapies now doing a fantastic job in young diabetics also, but it is not a good sign for anybody in long run having calcific bad vessels, triple vessel disease. And other thing is the diabetes can affect the cardiac muscle directly. The cardiac muscle directly affecting is called cardiomyopathy. Though arteries will be normal in angiogram, but if you see the patient comes with heart failure with breathlessness, both left side heart failure, right side heart failure, and there is no other end either to go for a transplant program, or there are in between therapies like a left ventricular assist device, heart failure devices are there, or a CRTD device. These are higher end treatments along with the medical management. So there is a muscle involvement. And third involvement, as I said, the neurons get affected in a diabetic heart also. These are the very important cardiac involvements in diabetes. And in addition to the diabetes, the also affects the kidneys, and it affects the retina, it affects the limbs. So ischemia comes very fast, and sometimes the people go for amputations. The treatment parts are very difficult in diabetes. How? Because these are all calcic blood vessels. They become thin, and for stenting or surgery, they are not very good blood vessels. That's why some of them go for medical managements along with aggressive control of the diabetes. What we should do? to recognize these problems is at 35 years age, I think everybody should get a fasting blood sugar, a glycosylated hemoglobin, which tells you at least 3 months of your average blood sugars and the lipid profile and the ECG and a 2D echocardiogram. If possible, if doctor prescribes, you should undergo a treadmill test or you can undergo a CT scan. That is a very big advantage nowadays. A CT CAG, if your creatinine levels, kidney levels are normal, then you can do the CT scan of the heart, which gives you a silently how much the calcium buildup over the blocks like that. This is only a preventive way which can. Now, I think the guidelines may change again because the diabetic population is very high. It is coming at a very young age. All these screening programs may have to be done at a little younger age in India.